Hi, everyone. I'm Dr. Angela Bollich. I'm a clinical neuropsychologist in the Center for Autism Spectrum Disorders, or CASD for short, in the Department of Neuropsychology at Children's National Hospital. I work with school-aged children up until young adults who are referred for evaluation when there's a question of an autism spectrum disorder. But our CASD team sees children of all ages for evaluation and treatment for symptoms of autism spectrum disorders. Today I'm going to be talking about autism, but before I start, I need to clarify that some people with autism prefer identity-first language, like autistic woman, autistic male, because they feel that being autistic is in fact part of who they are, like describing that they're tall or American or gifted or musically inclined. Other individuals prefer person-first language as a girl with autism. I want to alternate my language when I'm talking about autism to respect these different views. So what is autism? What the medical community refers to currently as autism spectrum disorder, and it includes individuals diagnosed with Asperger's syndrome prior to 2013, which already tells us it's a diverse group of people. The medical community identifies autism as a developmental disorder that reflects problems in three primary areas. One, social communication challenges. So the person may not recognize social cues and know how to respond appropriately. For example, someone may greet them, but they're thinking about something else and may not recognize that if they don't respond, the other person may feel hurt. Individuals with autism also show very strong interests or intense interests or repetitive behaviors, and sometimes both. So they might enjoy just making a noise over and over again, or flipping their fingers around or flapping their hands. And their interests or behaviors can distract them from what others are trying to share or talk about. And they may not recognize that other people do not share their own interests. A challenge that goes along with this strong interest and repetitive behaviors is difficulty shifting their thoughts or attention or changing their behavior to go along with what other people expect. And it can be really difficult for a person with autism to adjust to changes in what they expect or want to happen. The third area is that many individuals with autism process sensory information in a different way from most other people. They can be very sensitive to sounds, so that it's painful or very uncomfortable what we might find tolerable or even enjoy. They may be drawn to how some things look, like a spinning fan, and find it fascinating and not be able to shift their attention or just enjoy it, or really enjoy a really tight embrace, or just being pressing up against other people. And they may not recognize that that's different. The autistic community defines autism differently. You would likely get a different response on what autism is from each individual you ask. But many identify in some way that it's an identity for them that reflects a different perspective from most other people. This tells you that autism is not the same for everyone. There's a range of views on how to speak about autistic individuals. They show a range in their skills. Some do not communicate with words, and others are gifted in their language skills. Some prefer to spend most of their time alone with their interests, and others actively seek out to share their interests. They seek out others to share their interests. Some are intellectually gifted, and some have intellectual impairments, and others are somewhere in between, just like individuals without autism. How do you talk to children about autism? Understanding autism takes time, so it won't be one conversation. but multiple conversations about the different characteristics of autism, including social communication, intense interest or repetitive behaviors, and sensory sensitivities or sensory seeking behaviors. There may be important opportunities to start the conversation. April is Autism Acceptance Month, and you might see advertisements or signs about it, and that could be a good way to start the conversation. Other opportunities may just present themselves. The child may have a friend or have a new classmate who has autism, or they might watch a show that has a character with autism. All of these are opportunities to start the conversation in order to help your child begin to take a different perspective and understand individuals with autism. In terms of speaking to young children versus older children, younger children tend to have a briefer attention span, so it's going to be a short conversation, maybe just on one point, just to help them start thinking about it and recognizing autism is not good or bad, it's just a description. With older children and adolescents, then it would be appropriate to have a more in-depth conversation to help them try to take that perspective of that other individual. Why should you share your child's autism diagnosis with others? It's important for us to help build the community of individuals to support and accept individuals with autism. And the way to do that is to educate them. Parents are often concerned that others are going to perceive their child in a negative way if they share the diagnosis, just like they're concerned that their child may perceive themselves in a negative way if they share the diagnosis. What we know, though, is that children with autism often recognize themselves as being different from their peers, and sometimes they view that difference in a negative way. And they come up with labels, incorrect labels, to define themselves. Similarly, their behaviors may be misunderstood by others. So when a child is feeling stuck and has difficulty doing something that to them was unexpected, they may be viewed as oppositional or disrespectful, instead of just having a difficult time shifting to follow along with what others are expecting. Anytime that we can expand someone's understanding, then we're going to build support for that individual. And I truly believe that knowledge is power. And so when the child has knowledge and understanding of their diagnosis, then they can see themselves in a more positive light with a balanced view of strengths and challenges, just like we all have. And then that helps them identify steps to take to address those things that are getting in their way so they can be more successful. How has the pandemic and quarantining affected patients with autism? I earlier mentioned that individuals with autism often have a difficult time adjusting to changes in expectations. And the pandemic has certainly brought a big change to everyone's life. So for children, not being able to get on their usual bus, to take their usual seat in the classroom, can be very disruptive. And it's been difficult with so many changes to parent schedules, how they're going to learn, for the child to absorb. It's been difficult for them to find their new routine, to get comfortable. That's been one of the biggest challenges. Another challenge is just understanding how to be safe and when they are safe. So there's been so many rules to follow on how to be safe during the pandemic. First, we were told we didn't need masks, and then it was recognized that masks were very important, but that we don't need gloves all the time. These are all changes in how the child is expected to behave and it can just take more time for them to adjust. There have been some positives for children, though. Some children have found that the online format reduces social pressure and allows them to work at their own pace. Other children that have returned to the classroom with smaller class sizes have found also that this is beneficial because there's reduced social pressure. There's not as many students that they have to try to figure out what they're communicating, and that's made it easier for them. I'm here to support individuals with autism, not to speak for them. They speak for themselves. They have a different perspective, which means that they have unique solutions to problems that other individuals may not have been able to recognize. And we want to embrace that and accept them as part of our community. Thank you.